Listen, we're not trying to scare you, but the numbers are still pretty staggering despite a lot of great research where heart disease is concerned. So, George, to talk about it, there have been a lot of gains made, but it's still a deadly problem.
That's right. In the United States, heart disease is still the #1 killer of people above the age of 30 to 40 years of age. That heart disease comes in different varieties. One of them, and what people think usually is heart disease, is related to hardening of the arteries. During my 25 years of practice, I've seen the rate of death go down from 10% or even higher when you used to come with a heart attack to, in some cases, as low as 2%. That's a substantial improvement in the overall outcome. Heart failure, which is the failure of the heart to pump blood to the rest of the body, still in 2018 may carry up to a 50% risk of mortality or death at 2 years. So we've come a long way, and we still have a long way to go.
And without research, there really isn't anywhere to go. I mean, you can continue to treat, and you have some fantastic technologies that you can use as resources, but the research is just vital.
Research is the next step towards progression. We don't like to do anything by hearsay. It's not anecdotal data. If you can't measure it, you can't improve upon it. And so research is that measurement.
And that's where East Coast Institute of Research comes in, because they do studies, and they have partnered with you, because it takes not just finding the perfect patient to be a part of these studies, but also they need to determine what it is you would like to see researched.
That's correct. We've formed a partnership with them. It is a signature or the doormat to the office, and we felt that we were quite compatible with them as far as patient care goes. We bring in and we look at the studies that are out there. Usually these are phase 3 studies, meaning that these medications have been looked at, deemed safe, but there's still a question of, do they work in real life? And so these are the next step technologies that might lead to reduction of that heart failure death, decreasing that 50% mortality at 2 years. It might help further that 2% risk of death with a heart attack down to 1%. So it is an exciting time.
You know, and it's also something that's kind of rare to have somebody with 25 years experience plus that is also on the cutting edge, because you might think you'd have to sacrifice one for the other, but you're looking towards the future and trying new technologies to save lives, and yet you bring with you experience.
This is something I never imagined when I first came out of medical school. I always thought it was a research career or a clinical career, and this has been a great integration. Somebody has to be working as a liaison between the current research and the patients, and that's what we've been able to put together down here in St. Augustine through ECIR.
Dr. George, thank you for both your time and for the continued research. If you'd like to get in touch with East Coast Institute of Research, you can give them a call at 904-854-1354. That's 854-1354, or eastcoastresearch.net. Thanks again.
Thank you very much.